Macqueen from Acupuncture DVDs. I'm inviting you to one of my 3 workshops that I'll be presenting in the UK and the USA in September and October of this year, 2011. It's a 3-day seminar and it's titled Shortcuts to Great Results in Muculo-seletal Acupuncture and Bodywork. As you can see, we've got a lot of varied material here, and I'm going to try my best to make it as exciting and interesting for you as I can. So I'm going to, again, take a contact and push. I'm just going to move that arm back a little, but if in practice what usually happens is the majority of people who are going to have a shoulder problem, they can't do that. They're lucky if they can get to there. This is the speed I work in clinic. Thanks.
Yeah, it's, I think it's still locally.
Thanks, Gabe. We will be making a DVD of the whole seminar. This will be 6 DVDs, and one of the things that we realised last year when we did it was that people can't remember. You just can't remember all the stuff that I'm going to present. I got to read you these. These are a couple of testimonials. That's right, they're testimonials from what people said after their I think it was 2008. T writes, I just wanted to say that I really enjoyed your course, and I've used both the needling techniques and the stretching on some clients with fantastic results, smiley face. The neck needling is particularly getting super fast results, and I'm rubbing my hands for the next frozen shoulder. That's amazing. So thank you. It was really nice to meet you, and take care of yourself. Warm regards, T. Thank you, T. There's another one. Okay, this revolves more around the psoas work that I did, the lower back stuff. Hi Phil and Jules. Delighted with the material you gave us, and I've been dishing out to everybody, regardless whether they needed it or not. That's enthusiasm. The psoas loosening is mind-blowing, and I've had near miraculous results with the neck stuff. So thank you very much for that, PU, and thank you, PU. I appreciate that. It's great feedback. Okay, enjoy. Still the stuff in the pack. Now, before we go any further, I would like our man here to come up the front, tell everybody his name, for those people who don't know him, and he's got a story he's going to tell you. Please. That's my little miracle story for the morning, but we've got Brendan. Sorry, Brendan. Brendan's going to tell us a wee story about what happened last night when he went home.
Yeah, so I got home last night. I left a little bit early to get a train. When I got home, I got a phone call, and this patient asked whether I could see her. And I said, okay, I'll see you. So I got in last night, and I got her in last night, yes. And yeah, anyway, as it happens, when she arrived, I asked her what her main complaint was, what was her problem, and lo and behold, what was it? It was a shoulder and neck. Yeah, one-sided. I said, yeah, right, I think I can fix this. So I did this stuff that we were doing yesterday, you know, the examination, the recording, the whole bit, and she had one side of her neck had pain on palpation, and she had you know, a limitation of movement. I did this stuff, and it all kind of worked out. She was kind of out here on me on one side and out here on me on the other side. Yeah, so we were talking about kind of quite restrictions or restricted. So I kind of did a little bit of Phil's ramble in terms of motorbikes and brakes and crashing walls, and if this happens, it happens, and if it doesn't happen, it doesn't happen, and so on, and treated her, and I used a couple of your points on here, and did the tendon stretch, which worked a treat, and really got lovely propagation of chi on heart 7, because she was a little bit tense and she was working kind of hard, and put in gallbladder 34 for that same reason. So a lot of the stuff that you said yesterday, really, I did, and you know, she walked out a cured woman. Literally, I mean, she came in and she was in a lot of pain. She travelled from Driffield to me in Scarborough. She'd worked in Manchester that day, and she had a lot of pain. She kind of called me on an off chance, and I said, yeah, shoot in. And you know, so she was obviously unwell and had been for a while to travel kind of 35 miles on Saturday evening to get a treatment. So yeah, a real treat.
Thanks for sharing. Isn't it interesting how we get looked after? Remember I said yesterday we get looked after, we get given people and so on, and it'll happen for you. Yeah. And that's fantastic. Yeah. Thanks heaps for sharing, and really great. It's good that you got a result like that. Yeah, because it works.
It's really good. Yeah. In fact, actually, I said I had been on the course during the day. She says, "Have you been learning this stuff, Brendan?" I says, "No, not today. I know this stuff." Kind of cack-handed, I'd say. Okay, cheers.
Top of the morning to you. Isn't that fantastic? Okay. Well, there you go. Like I said yesterday, we get given opportunities, and Brendan took his opportunity, and that's fantastic. And you'll get it. People will present the magic point on the neck.